Welcome to HealthSphere MD, the channel where complex medicine becomes genuinely clear. Today, we are doing a deep dive into one of the most prescribed medications on the entire planet, Metformin. Whether you've just been diagnosed with type 2 diabetes and your doctor handed you a prescription, whether you're managing a condition like PCOS, or whether you've simply heard the name and want to understand what this drug actually does, this video is for you. We're going to cover everything. What Metformin is, where it came from, exactly how it works in your body, who should and shouldn't take it, how to take it properly, what side effects to expect, how it affects your weight, and finally, some genuinely exciting new science that may make this humble, affordable pill far more important than anyone ever imagined. Let's get into it. Metformin is an oral medication, meaning you take it as a tablet, used primarily to treat type 2 diabetes. It belongs to a class of drugs called biguanides, which work by improving the way your body handles glucose, or blood sugar. Now here's something that surprises a lot of people. Metformin is not a new drug. Its origins trace back to a plant called Galega officinalis, also known as French lilac or goat's rue, which was used in traditional European medicine for centuries to relieve the symptoms of what we now know as diabetes. Scientists isolated the active compound in the early 20th century, and by 1957, metformin was being prescribed clinically in Europe. It took until 1994 for the U.S. Food and Drug Administration to approve it for use in the United States. And since then, it has become the undisputed number one first-line treatment for type 2 diabetes worldwide. The World Health Organization includes it on their list of essential medicines. The American Diabetes Association, the European Association for the Study of Diabetes, and virtually every major clinical guideline globally recommends it as the starting point. Today, over 150 million people around the world take metformin every single day, and it costs, in many countries, less than $1 per day. That combination, effectiveness, safety, and affordability, is extraordinarily rare in medicine. This is where things get genuinely fascinating. Metformin works through three distinct mechanisms, and understanding them helps explain why it's so effective. Mechanism number one, it reduces glucose production in the liver. Your liver is constantly releasing glucose into your bloodstream. This is normal. But in people with type 2 diabetes, this process becomes overactive, especially overnight while you sleep. You wake up with high blood sugar even before eating a single thing. Metformin suppresses this excessive hepatic glucose output, primarily by activating an enzyme called AMPK. And we'll come back to AMPK later because it's very important. Mechanism number two, it improves insulin sensitivity. Your muscle cells and fat cells have insulin receptors. Think of them as locks and insulin as the key. In type 2 diabetes, those locks become resistant. They don't respond properly. Metformin helps restore that sensitivity so your own insulin can do its job more effectively. Mechanism number three, it slows the absorption of glucose from your gut. After a meal, glucose from your food enters your bloodstream. Metformin slows that process down, blunting the sharp post-meal blood sugar spikes that are so damaging over time. The result of all three mechanisms working together is lower fasting blood sugar, smoother post-meal glucose levels, and better long-term control, all without causing dangerous hypoglycemia, meaning dangerously low blood sugar on its own. The primary indication, meaning the main approved use, is type 2 diabetes. It is almost always the very first medication prescribed when lifestyle changes alone aren't enough to control blood sugar. It is also used for prediabetes, where blood sugar levels are elevated but haven't yet crossed into full diabetes territory. Studies show metformin can delay or even prevent the progression to type 2 diabetes in high-risk individuals. Polycystic ovary syndrome, or PCOS, is another well-established use. PCOS is strongly linked to insulin resistance, and metformin helps address that underlying problem, often improving hormonal balance and menstrual regularity in the process. Beyond these, metformin is used off-label, meaning outside its strictly approved indications, for things like non-alcoholic fatty liver disease metabolic syndrome, and, as we'll discuss shortly, even longevity research. However, metformin is not appropriate for everyone. It is not used in type 1 diabetes. It must be used with caution or avoided entirely. In people with significant kidney disease, severe liver disease, or conditions that increase the risk of a rare complication called lactic acidosis. Your doctor will always evaluate your individual situation carefully before prescribing. Metformin comes in two main forms: standard-release tablets and extended-release tablets, sometimes labeled ER or XR, with brand names like Glucophage XR, Fortamit, or Glumetza. With standard-release metformin, the usual starting dose is 500 milligrams, taken once or twice daily with meals. The dose is then increased gradually over several weeks, typically in 500 milligram increments, to give your body time to adjust. Most people end up on 500 to 1,000 milligrams twice daily. The maximum daily dose is around 2,550 milligrams, though most patients don't need to go that high. With extended-release metformin, it is usually taken just once daily with the evening meal. Extended-release tablets must be swallowed whole, never crushed, split, or chewed, because breaking the tablet destroys the controlled release mechanism entirely. There is one rule that applies to both forms without exception. Always take metformin with food. This dramatically reduces the chance of stomach upset, which is the most common reason people stop taking it early. If you miss a dose, take it as soon as you remember, but only if you can take it with food. If your next scheduled dose is coming up soon, simply skip the missed one and continue as normal. Never take two doses at the same time to make up for a missed one. Let's talk about side effects, because this is one of the most common reasons people feel anxious about starting metformin, and it deserves an honest, thorough answer. The most frequently reported side effects are gastrointestinal: nausea, loose stools or diarrhea, stomach cramps, bloating, and a metallic or bitter taste in the mouth. These sound unpleasant, and they can be, but here's the important context. In the vast majority of people, these symptoms are temporary. They typically appear in the first 1 to 4 weeks of treatment and then fade as the body adjusts. The two most effective strategies for minimizing GI side effects are: start at a low dose and increase slowly, and always take metformin with food, ideally in the middle of a meal, not before or after. Switching to the extended-release formulation also significantly reduces GI discomfort for many people. Now, there is one rare but serious risk: lactic acidosis. This is a buildup of lactic acid in the bloodstream. It sounds alarming, but it is genuinely very rare, occurring in fewer than 10 cases per 100,000 patient years. It is mainly a concern in people with poor kidney function, advanced liver disease, severe heart failure, or those who drink heavily. Finally, one important long-term consideration: metformin can reduce the absorption of vitamin B12 from the gut over time. This is well documented. Long-term users should have their B12 levels checked periodically, at least once a year, and supplement if levels drop below normal, as B12 deficiency can cause nerve damage and fatigue if left uncorrected. One of the things that makes metformin stand out among diabetes medications is its weight profile. Many diabetes drugs, particularly insulin and the older sulfonylurea class, cause meaningful weight gain. This is deeply counterproductive because the vast majority of people with type 2 diabetes are already managing their weight as a central part of their condition. Metformin, by contrast, is weight neutral to modestly weight reducing. Clinical studies have shown average weight losses in the range of 1 to 3 kilograms over 12 months. Not dramatic, but meaningful and in the right direction. Why? Because metformin does not stimulate insulin secretion directly, it doesn't drive fat storage the way many other agents do. It also appears to reduce appetite in some patients, likely through effects on gut hormones. It is not a weight loss drug by design, but among the available options for type 2 diabetes, it has one of the most favorable weight profiles, and that matters enormously for the long-term health of patients. Now for the part that genuinely excites researchers around the world. Scientists have been accumulating evidence that metformin may do far more than control blood sugar. Let's look at the most compelling areas. Cancer research. Multiple large observational studies have found that people with diabetes who take metformin have lower rates of several cancers, including colorectal, breast, liver, and pancreatic cancer, compared to those on other diabetes medications. Researchers believe this is connected to metformin's ability to suppress mTOR, signaling and activate AMPK, both of which play roles in regulating cell growth and proliferation. Cardiovascular protection. The landmark UKPDS trial, the United Kingdom Prospective Diabetes Study, found that metformin reduced the risk of heart attacks in people with type 2 diabetes significantly more than blood sugar control alone would explain. It appears to reduce inflammation, improve the function of blood vessel walls, and lower cardiovascular risk through mechanisms that go beyond glucose management. And then there's perhaps the most fascinating frontier of all, longevity. Metformin activates AMPK, which is often called the body's master energy regulator. AMPK activation mimics, at the cellular level, the effects of caloric restriction and exercise, two of the most reliably life-extending interventions we know of. This is the scientific rationale behind the TAME trial, targeting aging with metformin, a landmark NIH-backed clinical study enrolling thousands of non-diabetic adults to test whether metformin can genuinely slow the biological aging process and delay the onset of age-related disease. Results are expected in the late 2020s, and the scientific community is watching closely. There are several specific situations where metformin must be temporarily paused or stopped entirely, and being aware of these could genuinely protect your health. Before any procedure involving contrast dye, such as a CT scan with contrast or a coronary angiogram, metformin is typically stopped 48 hours beforehand. Contrast dye can temporarily reduce kidney function, and if the kidneys aren't clearing metformin properly, lactic acid can accumulate. Always tell your radiologist and cardiologist that you take metformin. Before surgery requiring general anesthesia, metformin is usually paused 24 to 48 hours prior. Your surgical team will advise you specifically during severe acute illness, particularly if you're vomiting, severely dehydrated, or have a high fever. Kidney function can drop rapidly. Stop metformin during these periods and restart only once you've recovered and your doctor confirms it's appropriate. If you experience dramatic lifestyle changes, significant weight loss, a major improvement in diet and exercise, your blood sugar may improve to the point where your dose needs to be reduced or metformin stopped altogether. This is a success story, not a failure. But never make that change without medical review. Let's bring it all together with the key takeaways from today's video. Metformin is one of medicine's great success stories. Safe, effective, affordable, and backed by more than 6 decades of real-world evidence. It lowers blood sugar through 3 complementary mechanisms: reducing liver glucose output, improving insulin sensitivity in muscle and fat cells, and slowing glucose absorption from the gut. It is the first-line treatment for type 2 diabetes globally and has important roles in prediabetes and PCOS. Its weight profile is favorable compared to most alternatives. Its side effects are mostly manageable, especially with the right starting strategy. And beyond diabetes, the emerging science around cancer prevention, cardiovascular protection, and aging is compelling and still unfolding. As always, every decision about your medication, starting it, adjusting it, or stopping it, should be made with your healthcare provider based on your individual situation. If this video helped you, please subscribe to HealthSphere MD for more evidence-based medical education every week. Take care of yourself, and we'll see you in the next one.